Americans spend an estimated $3 trillion a year on health care. This is nearly twice the amount that any other country in the developed world spends. Whether it's going to the doctor for a routine checkup, getting a prescription for back pain or neck pain or headaches, or having a surgical intervention or procedure performed, health care is downright expensive. Now, these costs can be significantly reduced if we start to focus on some very simple things, and in particular proactive healthcare versus reactive healthcare. Now, of course, proactive healthcare, preventative; reactive healthcare, reacting to the disease. So what in the world really is proactive healthcare? Why should we find it better than reactive healthcare? The term proactive, when used in the context of healthcare, refers to taking preventative measures to prevent or reduce the risk of health problems before the symptoms manifest. Now, most Americans visit a doctor's office when they're experiencing symptoms of disease or pain or an illness, fever, nasal congestion, migraine, weakness in the body. The doctor then performs an examination and then usually writes a prescription to the patient. That's the way the basic process is working. Now, proactive health care takes a different approach. Rather than visiting the doctor's office when you're already sick, we make lifestyle changes, or we seek complementary or alternative therapies before symptoms manifest, preventative medicine. Doing so may prevent the disease and the illness from rising, and making proactive healthcare well worth the investment of our money, our time, and our energy. As I mentioned earlier, Americans spend more than $3 trillion, that's with a T, dollars on healthcare annually, most of which goes towards reactive treatments that are not necessarily always that effective. These costs can be slashed if we make this transition toward proactive healthcare. And you ask yourself, so what can I do? How can I take a proactive approach to my healthcare? Now, one of the easiest ways is to begin to focus on diet, and focus your diet around natural, nutritious foods. And that should come as no surprise. The diet plays a major role in your health. When we consume highly processed foods day after day, our bodies begin to feel the effects of these bad choices. We become fatigued, sluggish, and our bodies lack the power to ward off the disease which may be trying to get into our body. At this point, we become more susceptible to illness, and eating the right foods, on the other hand, will reduce your risk of health problems by stimulating your immune system. So that's the number one choice. Some of the other choices, of course, are regular exercise, meditation, stress reduction. Stress is another major component, which is a very negative effect on our health. And these are the focuses that using proactive versus reactive healthcare that can have major impacts on your health. And it's very easy to perform. It's just going and taking the time and the effort to embrace these techniques, to embrace these lifestyle changes, and you find your health will definitely benefit from these changes. So every week we take a little time to give you a little bit of information to try to make your life a little better. If you have any questions, go on our Facebook page, and we'll try to get back to you as soon as we can. So thank you for the time that you've spent listening to this message, listening to this video, and I hope this helps you to just have your life be a little bit better, embracing proactive healthcare versus reactive healthcare. Thank you again.